So there are quite a few different types of antibodies that we've mentioned in a past video. The most important ones for arboviruses, especially in the diagnosis of them, is IgG and IgM.
Okay, so the IgM and the IgG response is really important. What happens, and I'll talk you through these graphs, is ignore the one on the right for a minute. Let's just focus on this one. And what we've got is time since you first started feeling ill, so time since... How much IgM can we detect? How much IgG...
So, with primary infection, so the first time you're infected, depending on how much IgG or IgM you detect in a serotype test, tells you like what stage of infection you're at.
Can we detect? And remember, those are two different types of antibody, which are an antigen on the surface of the dengue virus, so we can try and pick up that antigen. And these different things, detecting these different things in your blood, or in your saliva, whatever it is that you're looking in, is incredibly important for diagnosing these viruses. And we're going to talk about diagnosis in a little while. So what we see when we're infected, when we first get ill, is that at the point where we get ill, we first feel that we've got a fever. Our viral load,
So when you first get ill for the first time ever, you can see
the virus's RNA and how much of the antigen can be picked up.
we can detect a high amount of the viral RNA and the antigen of the virus.
Going to be high. That makes sense, right? When there's loads of viruses,
So when there's loads of viruses, you obviously have loads of RNA.
To get ill. But quite quickly after you become ill, the virus itself, the viral RNA itself, and the antigen will sort of start dropping off.
But very soon after you actually become ill with the virus, the amount of RNA and antigen sort of decrease.
Be able to detect it after a couple of weeks or a few days. Whereas in your antibody response is obviously kicking in.
But your antibody response is kicking in, so you can see the IgM is increasing.
And when you get ill, when you first get a fever, this is when your IgM starts going for it. And the IgM can't be picked up straight away as soon as you get ill. But after, say, 6, 7, 10 days, it peaks, and there's high levels of IgM that can be detected in your system. We can test for that and see if you've got it. It will then obviously decrease. What you'll notice is that IgG comes in much later. Okay, it sort of like doesn't kick in until a lot later on. So depending on how many days you are post...
IgG then kicks in a couple days later. So depending on the stage of infection that you're at, or how long you've been infected, influences what we can detect to diagnose it.
Getting ill depends on which of these tests is going to be the most appropriate and the most reliable to pick up whatever's going on. So if we've got a patient and we suspect that they have got dengue and they've been ill for sort of 5 days, there's absolutely no point doing a test.
So if you have like a patient that's been ill with what you think is dengue and they said they've been ill for like say 5 days, there's no point in doing an IgG serology because it's just not going to show anything up. So it'd just be a waste of time and money.
IgG antibodies, because they won't be producing IgG yet. So a negative IgG test does not mean that a patient hasn't got dengue necessarily. Okay?
So a negative IgG test doesn't mean that a patient doesn't have dengue, it just means they're not at that stage yet.
To do with timings. Does that make sense? What we find with dengue, and we're going to talk a bit more about this later on, is that secondary dengue infection is very different to first infection. So if you are then...
Secondary dengue infection is very different to primary dengue infection.
Infected with dengue, probably another serotype, different type of dengue, but still dengue, you basically get an explosion of everything from the start. So
if you get reinfected with dengue, which it tends to be with a different serotype, you get like an explosion from the very beginning of the infection.
IgG is already woken up, it already knows about dengue, so it's going to go from it straight from...
This is because you have memory of it.
So that is another important consideration when we diagnose a patient with an arbovirus, is have they been infected before, because that will affect our decision making.
So that's an important thing to think about when you're diagnosing as well, if they've been infected with it before, because obviously if you do a IgG test in someone that's never been infected before and they're at day 5, they're going to show no IgG. But if you do it in a person who's had a secondary infection at day 5, then it will show IgG.
Make sense? Yeah. Okay. So I've already basically you said all this and hinted at it, but let's talk about dengue.
So, as well as serologies, there are a few other ways that we can diagnose dengue. The first ones that I'm going to list off are the best ones, they're the most direct ones, and they have the highest confidence in result. And that is to detect the viral genome and isolate the virus. Your next best ones are your antigens, so it's your IgM and your IgG serologies. These are rapid diagnostic tests. They're very easy to do, but they do have limited sort of confidence.